Hello, my name is Dr. El-Zawahry. I'm a urologist specialized in bladder health and pelvic floor reconstruction. In this video, I'm going to talk in brief about ureteral stents. Ureteral stents is a very common in use in urologic procedures, and many patients ask many questions about these. So this video hopefully will help to provide some basic answers about the stents. Before I continue, we need to learn about urinary anatomy. The anatomy of the urinary tract is simple. The urinary tract composed of two kidneys, two ureters, bladder, and the urethra. The kidneys are responsible to make urine, and this urine is transported from the kidney to the bladder through the ureters. These ureters are small, narrow tubes, and they're about 12 inches long. The stent comes in this area. The stent is going to be between the kidney and the bladder and the ureter. The goal is to make sure that the ureter is open to allow urine to move freely from the kidney to the bladder without any blockage. So these stents usually about 12 inches long. They are small hollow spaghetti tubes. They have two coils, one in the kidney and one in the bladder. The coils are responsible to keep the stent in place without traveling up and down. When do we need to use the stents? The stents are commonly used after any procedure that we go to the ureter or the kidney with endoscopy, and sometimes even with open procedures. And the reason for that is it helps to maintain the ureter open, because after any procedure you're going to expect some swelling, some edema, some blood, and in these cases it can block the ureter. So the stent comes and maintain that open. Also, if you have any damage to the ureter or blockage of the kidney from stones, from scar, from blood clot, from cancer, the stent will help to unblock the ureter. The third situation is whenever we are going to go for a procedure in the ureter. If I'm trying to get a stone and your ureter is tight, then I need to have a way to open the ureter for my instruments. And in this case, I put the stent for a week or two. So as you see, the stent goal is to make sure that the ureter is open. Because if you have a blockage, this blockage in the ureter will cause blockage of the kidney, and with continuous blockage over time, the kidney can lose its work and can be damaged, and this eventually will lead to renal failure and dialysis, and we don't want that. So if I have the stent in, what is expected? What do you think the stent is going to cost you? The stent has, as I mentioned, two coils, one in the kidney and one in the bladder. The one in the kidney can cause some discomfort in the flank. You can feel a little bit of nagging sensation, and usually it's tolerable. The other one in the bladder can be causing some discomfort in the bladder, and it's usually making your bladder more sensitive. So you feel like I need to go to the bathroom more frequent, I need to rush to the bathroom, I wake up more frequent at night, I might have some leakage whenever I try to go to the bathroom, blood in urine. All of these are expected with the stent. Many times patients think that this is urinary tract infections. No, it is not. It is the stent irritation that causes that. The good news is once we remove the stent, everything goes back to its baseline. So you don't concern about that. How can we deal with these situations? Usually for bladder pain, you can take some over-the-counter pain medications. Some of the medication that can turn your urine orange may be helpful. Ibuprofen, Tylenol, these are all helpful. If you have severe bladder spasms, your urologist can give you some medication for bladder spasm. If you have urine problems with blood, you can drink a little bit more liquids, and this can flush your system. You don't need to go to the ER for these situations. So when do you need to go to the ER? If you have fever more than 101.5, especially if it is associated with chills, you need to rush to the ER or call your physicians immediately for advice. If you have extensive bleeding associated with clots and this makes you not able to pee, you cannot go to the bathroom, or if you go to the bathroom you cannot empty your bladder well, then that's a situation that you need to ask help. If you have nausea and vomiting and pain, then you need to consider asking for help. Usually I consider this a problem if it is persistent and continuous and the regular medication don't help with that. So when do we need to remove the stent? The stent is usually removed based on your urologist's recommendation, and it can be for a longer time in special circumstances. We remove the stent by one of two ways. Either your urologist bring you back to the operative theater, and it's a small procedure where they go when you are awake. It doesn't require any anesthesia, and pull the stent out. The other way is we leave string that is like a fish line, dark in color, coming out of the urethra, and we recommend you to pull that out. It's easy, simple, and it does not have any problems. I recommend for my patient to use ibuprofen or Tylenol 1 to 2 hours before that, and this will help to relieve the discomfort. And usually all urinary symptoms will come back to its baseline within a day. Hopefully this video will provide you with the answers you were looking for, and I wish you a good day.